the pandemic has really caused nursing practice to have to change very quickly to accommodate more virtual care than ever before. And so with patient-reported outcomes in our clinical setting, because we do have a hybrid approach in that we have an in-person workflow where patients would complete a patient-reported outcome tool in the clinical setting on a piece of paper. It would be used in clinical practice and entered into the EMR after the clinical encounter. The pandemic has really negatively impacted that process because about 35 to 40% of our patients on any given day are now being seen virtually in our ambulatory oncology settings. And so we had to do some modification of our process. And so we are in the midst of implementing a new EMR that will have a patient portal that will allow patients to complete it from home. But that takes a bit of time, and we are in the midst of launching and building for that. So there wasn't a lot of capacity to put something brand new in place. So we had to get creative. And so what we did was made available a very simplistic paper-based patient-reported outcome tool that's similar to the one we use in clinical practice. And we allowed clinicians, or we gave those to our clinical teams to then give to patients so they could take home with them. So at least the patient could have that with them when they do the telephone call. They could refer to the symptom rating scale and report their symptoms as they felt was relevant. And that has helped a bit. I mean, it's still hard with virtual care because without a digital portal and digital secure electronic communication, it's been very difficult to gather this information from patients before the clinical encounter. And so that was about the best adaptation that we could swing in the midst of the pandemic. And we're really excited that in the next 8 months, we will be going live with a tethered patient portal where we'll be able to deliver the patient-reported outcome questionnaire to patients 3 days before their appointment. They'll be able to fill it out at home. That information will flow digitally back into the EMR and be there for the clinicians when they go to assess their patient.